Good afternoon, everybody. Like Chen mentioned, we are from Mid-State Health Center, and we're here today to talk about building healthcare and childcare systems in rural settings. And Plymouth's not technically very rural, but it's far cry from Manchester, Concord, Boston. I was going to ask what majors were here today, but Chen has answered that question. Thank you. So we'll just jump right into our agenda.
So we're going to share a little bit more about who we are and what we do at Mid-State. I think something important is to kind of just see what jobs are available, especially coming out of school. You guys have a lot of options. Who Mid-State is, what we do, some of the challenges that our patients and staff face being from a more rural community, and how Mid-State has created solutions to some of these problems. Lastly, we'll talk a little bit about how you can get involved and share some of our biggest tips, and then we can go into our Q&A.
So I guess we'll start with just some quick introductions. I finished my undergrad in 2013. That's when it was still the Frost School of Continuing Education, which I don't believe exists anymore, but I was a non-traditional student, quite a bit older than my peers. And then in 2020, I completed the MBA. Like Chen said, it was the first cohort. We made it to the capstone project, and then COVID hit. So we finished the capstone on Zoom, which was kind of an interesting time to be in school. Yes. And then I entered healthcare in the same time, which was also an interesting time to enter the healthcare profession. Day one, they had me setting up vaccine clinics in the parking lot, so it was trial by fire. But anyway, so yeah, I'm the director of facilities, construction projects, and the capital improvements at Mid-State Health Center. In my 5 years that I've been there, we've gone from a 2-location medical facility to 6 locations, from Plymouth all the way up to Littleton. So we've been in a expansion phase pretty quickly. We are currently also in the planning stages of fitting up our Boulder Point location to incorporate it into a more cohesive family-style medical practice that will touch all aspects of family medicine. Just a quick overview of my typical responsibilities. I oversee and schedule all of my staff from facilities to janitorial. I manage all of our third-party contractors, materials procurement. When we have construction projects, I'm usually involved in selecting and bidding out and working with the architects and the contractors, and it's really never a dull moment when you're working for a company that's always trying to expand and move forward. Would you like to talk about?
Sure. So I graduated with my undergrad from Plymouth in 20, so also COVID years. I was one of the ones without a real graduation. Luckily, Mid-State threw me one, which was super wonderful. I got my MBA in 2021, and I got my certificates in strategic marketing management as well as healthcare administration as well. As Chen said, I started in healthcare in 2016. I started as a nursing assistant, so it was really helpful to kind of get that hands-on direct patient care before moving into this more administration role. I actually began in nursing school, and I decided that was not the right path for me. Nurses have a special calling, and I loved working with patients, but I really wanted to blend my love for healthcare and business. I really like to write and do graphic design, so this was kind of meeting in the middle. I started at Mid-State in a public health role, and I quickly got under the wing of our grants director and became the communications assistant. Mid-State is a nonprofit. If you go and work in a nonprofit, what you're going to learn is that your job description is a loose depiction of what you actually do. The biggest thing on your job description is other duties as assigned, and you can account for probably 50% of your job being that. Well, it can be busy. I think it's taught me a lot. I mean, it's been great. I've been able to work in operations. I've dabbled in HR. I helped with our retirement plan. So it's really broadened my skills. I help with grant writing now. I do some philanthropy a little bit. So although I'm the director of marketing and communication, I think that title, same with Josh's, is very loose for all the things that we actually are able to help with at the organization. The other cool thing is that as Josh said, we've grown since we've gone on. We had 2 locations, now we have 6, much owed to our CEO and our board of directors who have really chosen to pursue the mission of accessible and quality healthcare in our region. So it's kind of allowed us to mold and shape our departments that weren't super structured and now are. So it's been a very great learning experience. Midstate was my first real job out of college after my MBA. So I think it's been a really great jumping off point and I've gotten to learn a lot. When I'm not working, the most important part of my life, I'm a mom to an 11-month-old Penelope. So that's us at the aquarium a few weeks ago. So definitely juggling being a new parent and working full-time has been an interesting journey, but it's been awesome. How many of you have heard about Midstate Health? You're perfect. Definitely not as many as I expected, but that's okay. So we are a nonprofit, federally qualified health center. I'll get into what that means in a second. We serve central and northern New Hampshire regions. So we have just about 15,000 patients now, 6 locations across Plymouth, Bristol, Lincoln, and Littleton, about 215 active employees now, which is absolutely phenomenal. So I'll get into what we do, but something that's really important to me in our mission is this term FQHC. So what the heck does that mean? It pretty much means that we get federal funding from this organization called the Health Resource Service Administration. They give us this giant $330 grant every year specifically to serve primary care and support services to underserved populations. So even though Plymouth doesn't seem super rural to many of us, if you drive 20 minutes the other way into Alexandria towards Bristol, I mean, transportation alone there is insane. So I think even though we're kind of in this little hub here, our area is very rural. So the federal government kind of designates these deserts and they give certain places like us funding to do this really important work. So the other thing about FQHC is it impacts so many things across our organization. Reimbursement rates from payers, especially Medicaid. They come every 3 years. The government comes every 3 years and does this huge site visit where our board of directors and our staff have to rally together and make sure we're meeting all of these requirements. And while it seems daunting, it really helps us be able to make sure that we're providing these services to underserved populations and to people who couldn't afford healthcare if places like us didn't exist. So we have about 15,000 patients. Across New Hampshire, it serves about 330,000 patients. So this includes community health centers like your Harbor Care, Planned Parenthood, those types of things as well. So what we do, our goal is really to be a one-stop shop, we call it internally, for healthcare services. So we want to make sure that newborn to geriatric, we can provide as many services at an affordable rate without compromising quality to those populations. So we do primary care, we have a fabulous pediatrician who my daughter goes to, we have behavioral health, we have dental, we have same-day care, which is like a walk-in clinic. We have diagnostic imaging, which we'll talk about shortly. We have a childcare center, physical therapy, chiropractic. We have such an insane amount of services to offer people. So being in communications, I mean, just the show of hands here, it's so hard to get all of these great things that we're doing out to everybody in the community. So that's my job and what I work day in and day out to do, to make sure that we're communicating all of these services that are available so that we can get to the difficult populations to reach and make sure that those people who aren't seeking healthcare know that we're an option for them. The other part that we do is we offer a sliding fee scale. So a lot of our programs like primary care and oral health, we can actually discount for people who are at it's below a 200% federal poverty level, which is designated by our wonderful HRSA governance board. So we're able to actually give people a lower rate for their healthcare services if they meet income requirements. This is important because we've been diversifying, as Josh said, insanely over the past 5 years, and really that's to diversify our revenue streams, so we're able to pay for those like special programs that are offered free to patients with those other services that are making money. Quickly, so who we serve, in short, everybody. Everybody in the community is welcome. We do have a specific target on the underinsured, under-and-served populations, but we see newborns fresh out of the hospital. We see geriatric patients. We can help transition people to local partners that are on hospice. I mean, we really can see absolutely everybody. Being in a rural community, we really try to get those patients in the door. There's a really amazing practitioner we have who does newborn home visits. She has a beautiful story about this family who couldn't make it into the office, wouldn't make it into the office without her being able to go to their house because they don't have transportation. So transportation is a huge issue. Access to health insurance. There's a gap of people who make too much to qualify for state assistance like Medicaid, but they don't make enough to afford insurance premiums. So we really cater to those folks. Workforce shortages are always an issue. I think we are not unique to any of these issues, unfortunately. Workforce has been really difficult for everybody lately, so making sure we have the staff to accommodate this number of patients. Social determinants of health. Has anyone heard of this term? So if you take public health courses, you definitely hear this all the time. It's pretty much your non-medical factors that also affect your health. So your environment, your access to secondary education, if you can afford to go to college, your environment, your housing, your food security. So we also work to kind of wrap the whole person into their health care. We have an on-site food pantry. We have all sorts of partnerships that we can refer people to help with these sorts of things like housing, childcare. So that's super important for our patients.
We do have transportation.
We do have a van, transportation.
We have some van and some Subarus.
Josh oversees that.
It's a free service.
Yeah.
It's a free service we offer to people that can't make their appointments.
Yep.
So that's another good thing.
So with all of these challenges, what our leadership and board really does is take a look at what the community needs, what are we hearing that people need that they're not getting or that isn't in the area, and then we come up with a plan to fix it, which is our famous saying. So we're going to talk a little bit about the 2 projects that we've done most recently that have helped combat some of these challenges.
Yeah, so our most recent project that we just finished less than a year ago was the 28 Main Street project, where we have a same-day clinic and a full imaging suite with MRI, CT scan, X-ray. So we partnered with some community healthcare and business leaders, and we determined that there actually was a need for these services on Main Street in Plymouth. So we have 2 dedicated staff members that work on writing grants and finding and applying for federal and state funding opportunities. So through that combination of public and private funding and some low interest loans, we were able to purchase what was once the Bank of New Hampshire. Mm-hmm. It's right on the south end of Main Street. So it required a lot of renovation to meet our needs. We pretty much stripped down the entire interior of the building, right, to the outside walls, and did a complete fit up, complete with exam rooms, administration space, and then the imaging suite. A lot goes into a project like that. You go to a lot of planning board meetings. You have to get the blessings and permits from the town. You have to bid out the contractors and the architects. Usually 4 or 5 of each will apply, and so there's a lot of meetings and figuring out who can meet our needs the best prices. So there's a lot of criteria to meet. And the language on the grants and the funding is typically very specific, and it's typically tied to like a unique deficit of care in the area that this project can help alleviate. So they don't just give you a check and say, you know, go ahead, do what you want with it. So we did a complete renovation, and then it also, we're proud because it also created quite a bit of higher wage skills jobs for doctors, nurses, x-ray techs, and admin professionals. And I have a couple photos here. It just kind of shows you like the process that, you know, right down to the studs, and then the hallway being drywalled. That's our MRI machine getting installed, and that's just one hallway, like the finished product. It's came out nice. I like to think of that. It's almost like a museum hallway. We got the skylights and the artwork, so it's a real inviting place. I think the architects and the contractors did a great job. So Sam will just mention some of the services we do there.
This is gonna be where you can definitely tell I'm in marketing. So we have a new same-day care service for your unplanned health needs. So our goal with this service, we're not in urgent care, we're not licensed by the state of New Hampshire to be in urgent care, but it's really to keep our patients out of urgent care and emergency room centers. The healthcare system is so taxed right now. Workforce shortages, funding shortages. So we're really trying to keep our patients within our health system when they're sick. So we started a walk-in clinic. It is open to everybody. If you're not a current patient, you can walk in and become a same-day care patient with us. It's really so next time you come in, your record tracks. We can see why you were here last time, make sure something bigger isn't going on. What my favorite part about it is that we're not in urgent care, so you just have to pay your office visit copay versus your urgent care copay, which urgent care copays can be $100, $150. So our real goal is to save patients money, better health outcomes, better cost savings. My favorite part of Main Street is our diagnostic imaging services. Is anyone athletes in here? Have you had to get an MRI recently? Did you go to the hospital, a hospital? Yeah, so how did it take you a while to get in? Yeah, so if you ever need one again, make sure you ask your provider to refer you to Mid-State. We have the biggest opening MRI that you can get in New England. So it's different than an open MRI because the plate is actually further from your face. It's 80 centimeters versus like just the sides being open. You can go to a hospital if you need an MRI, $2,500, is that fair? It's $850 at Mid-State. So, and the scans are amazing. We have new technology, the software is great. We're a community health center. Something I'm battling is that you're a community health center, your scans aren't gonna be good, which is completely false news. They're amazing, and our imaging staff is top notch. So definitely look us up if you need us again. We also have CT, X-ray, and ultrasound available as well at a much reduced rate than traditional hospital settings. Again, one of the top causes of bankruptcy in our nation is healthcare, and we don't want to see our patients going through that, so we're trying to get as many services that we can in-house to really keep the costs down and their health outcomes up. We also have nutrition and lifestyle medicine, so really people with diabetes or chronic diseases can go see her, but also like if you're just trying to optimize your diet, she's fabulous. She can help you make meal plans, she can help you with grocery shopping, she can help you with like teaching you how to shop at the grocery store to make sure you're eating what you need to at a lesser cost, so she's great. And Littleton Regional Healthcare visiting specialists are also at this location as well.
All right, so let's move on to our second project we came to talk about today, and that was in childcare. So we opened up Little Antlers Learning Center. So Sam was talking about workforce shortages. One of the best ways, or the two key components, I think, to bring a workforce into the area is the two things that families need, and that's childcare and housing. Mm-hmm. We're not in the housing business yet, but
not yet.
Maybe that's coming. Anyways, so during COVID, 4 local childcare centers closed, and I believe 3 of them didn't reopen. So we saw that there was an opportunity to fill that gap. So we purchased, it was an old Sears appliance building on Tenny Mountain Highway. If you saw it before the renovations, you would think, how are you going to turn that into a childcare center?
Yeah.
It really just looked like a shell. It was kind of falling apart. So we purchased that. It needed a lot of work, inside and out. One of our first steps was that we started a community advisory committee. So we brought together local business owners, educators, and other stakeholders, because we really wanted community involvement in this. We wanted everyone to be kind of behind our mission, including the town. And we even did a contest to think of the best name. I can't remember who.
One of our staff members actually ended up naming it, which is funny because there are kids there too.
As soon as we saw that name, it was like a light bulb. Like that's really terrific. So it was a similar mix of funding. We had public funding through several channels, including, and for this project, we had a low interest USDA loan, which it was great to have, but that requires a lot of reporting. We had to create monthly construction reports, get them approved to pay the contractor. And for this project, we actually brought in a third-party consultant, since we were all fairly new at USDA funding. She helped us get through the process and educated us on the required reporting. And again, we had to get approvals and permits through the town. We went through a bidding process for architects and contractors. And then we pretty much demoed the whole inside of the building again. The roof, the siding, the site work, we put in solar panels. So actually, it's interesting, the solar panel array powers the whole building. And actually, in the summertime, there's enough surplus to go back into the grid. So that's a pretty nice project there. We have some pictures, but it's just a very welcoming place. We made sure there was lots of windows. There's an indoor, outdoor playground. You want to jump to the pictures? All right. These are. This is
it.
Yeah. These are some of the during the process. You can see, it was gutted wide open. A lot of this project happened through the winter, so there were definitely some challenges. It wasn't supposed to go that long, but it did. Samantha will mention some of the services we have there.
So we have about 62 total kids there. Childcare, there's a childcare crisis in New Hampshire. I don't know if anyone has kiddos in here, but childcare is really hard to come by and it's extremely expensive. So that was something we were working towards. Also helping pay our teachers a living wage. Childcare workers are statistically underpaid, so we do our best to make sure that they are not in that statistic. There's about 200 kids on the wait list right now. We also accept a state scholarship and offer a tuition assistance program. Because of our funding and because of our mission, 51% are low to moderate income families, so we really tried to make sure to be able to get people in who might not be able to afford childcare. We also offer free tuition for teachers and discounted for staff. So if anyone is ever looking for a job and has kids, Mid-State offers a discount on their childcare. I'll glaze over this, but I mean, why we did this, we've kind of touched on it a little bit. Childcare and housing are super important to get people into our region. We're in northern New Hampshire, recruitment's a problem, so we're really trying to bolster the economy as well as, better people's health outcomes, provide affordable and accessible both childcare and healthcare. It's really just kind of working towards our mission. We care deeply about our patients and we also care deeply about our community. So a lot of these projects are really, the patient's always at the center and the community is always at the back of our mind as well for why we do these things.
Yeah, so we just kind of wanted to go over some of the perks of working for nonprofits. Sometimes maybe you don't make as much money as you would in a for-profit company, but you do get to play a key role in creating, better, longer-lasting resources for families. We enjoy the fact that we can improve healthcare and childcare outcomes in typically underserved communities in rural environments. We like to offer the lower cost of services without sacrificing quality. And I was born and raised in Boston, so I enjoy the city, but there are definitely some perks to living around here. It's just a beautiful place to live. There's great opportunity, especially if you're into outdoor sports and all 4 seasons. And there, believe it or not, there really are many opportunities for a whole variety of professionals in nonprofit.
So we have 3 tips for your future. Usually you come to these, I remember speaking events, and you get all of this information and you're like, what the heck am I going to do with this? I came out of this program and was lucky that I landed at Mid-State and have been able to grow tremendously there. And I think these are the 3 things that I would say are most important coming out of the program, in my opinion. Weigh salary with mission. I looked around. Obviously, I wasn't stuck Mid-State forever when I started, although it's ended up that way. Other places might pay more in Concord or in Boston, but I really liked what Mid-State was doing. So I kind of looked at how can I make an impact? Where can I make the biggest impact? That's really important to me. And you kind of weigh that with salary. Is taking a little bit of a pay cut worth being able to do something you're really passionate about? The second is build a network, especially in small communities. Who you know is so important. I think my CEO kind of taught me this one. He knows everybody and everybody in the area. But you really are able to have good relationships with people, and making sure you have bridges in all sorts of areas is so important to being able to get things done. Surrounding yourself with people who have a like-minded mission as you and want to do the same things as you. So we surround ourselves with people who want to better the community, who are passionate about healthcare, who know their way around healthcare, and that's been extremely important. Then last one is be a sponge. Even if you think it's something that might not be important to you, you might have come to this talk today saying, what do I care about healthcare or childcare? I hope that you're able to kind of take some of these tidbits and take what's important to you and leave the rest. You're going to get a lot of information over the next few months, I'm sure. And so just absorb absolutely everything you can and take it with you. And most things are transferable skills. So.
This was just a regular sponge, but I changed it on her this morning.
Yes, Josh did change my sponge.
I was like, does anyone even know who SpongeBob is anymore? But anyways.
He said it was a joke, and I said we should leave it. That's all we got.
Thank you.
Thank you.